So welcome viewers. Today we are going to discuss about the organ transplantation, and today we have the expert from the field, Dr. Parno Prakash with us. Sir will tell us about the organ transplantation and the complications and the success rate of organ transplantation. So welcome sir.
बहुत बहुत धन्यवाद सर आपका. So first of all, I would like to say about what exactly is organ transplant. So organ transplant is when organs of living people or deceased people, dead people, they are harvested to be implanted into some living patient who has got some or other problem related with multiple different organ. Like in our times, kidney can be transplanted, liver can be transplanted, heart can be transplanted, pancreas and intestine can also be transplanted. It's not very old technology, only in modern era this is possible with the advent of modern surgical techniques as well as organ preservation technique, and certain medicines has also played great role in that, like immunosuppressant medicine, which we will subsequently discuss.
Very good, sir. So, sir, tell us about who need organ transplantation and how a doctor decide that the patient has need to transplant the organ, or he can revive the organ with already existing.
Great question, sir. As we say, it is one of the last resort. If someone is suffering from heart condition, so we go through multiple processes to support the function of heart. As we understand, the heart disease is like about the function of heart has been compromised. The heart is not functioning as it is supposed to be. So there comes a condition when the supply to heart has been disrupted, which we common language we talk about like heart attack. So in that condition, and which is technically called ischemic heart condition, so in that condition many times a large portion of heart muscles go dead. Even with multiple different processes, it cannot be revived. So person is living with the support of life support system. That is, when different machines are doing the role of kidney or liver or lungs or heart, but then in that condition, when person's own heart, for example, is not able to do the function fully and cannot really be revived, and a complete team of physicians and surgeons, they evaluate the patient and find that the person cannot survive without transplantation. His organ has failed beyond a limit from where one cannot be revived, and two, the patient also cannot survive without the transplantation. In such condition, after the recommendation of the doctors and after taking the consent of patient whose organ has failed, the team of doctor recommends that the patient should go for organ transplant.
Okay, sir, just tell us about which organ can be transplanted. Like commonly, we have seen that kidney are generally transplanted, but in nowadays we have so many example where heart is transplanted. So, which organs we can transplant, like heart, liver, kidney,
Ji.
and other? What about other organs?
Wonderful question, sir. For the knowledge of our viewers, now many different organs can be transplanted, and some very unique surgeries also have been done these days, which is expanding even the boundary of knowledge of science. Like in some time, whole skin of a patient was transplanted when the patient has very severe burn injury. So doctors in Italy transplanted the complete skin from one person to another person, from a dead person to another person. In other cases also, when some burn is involved or some traffic accident is involved, when someone's face is completely destroyed, so in that condition also complete face transplant has also been done. Whereas the other transplants, as you rightly talked about, kidney transplant and liver transplant, Another very interesting point I would like to add is that kidney transplant, why it is so common, because for the knowledge of viewers, we all have two kidneys, but even one kidney is sufficient for support of someone's the system of excretion. So that way, even living person can donate their kidney to another person. So many times we see that some child has donated the kidney to father. Very famous case in India was when daughter of Lalu Prasad ji gave kidney to her father, and Lalu ji's condition improved. So that way, kidney transplant is so popular because even living person with kindness and individual's care can support and transplant. And same way we talk about liver. So a certain portion of liver, if it is given and donated, the person who has donated survives, and someone whose liver has been complete failure also gets great benefit. But the same is not the condition, as we can understand, with heart. That's why the heart patient have got a very long waiting line when they get heart for transplantation. And same is the condition with other organs also. And today we can also transplant intestine of one individual into another. Pancreas transplant has also been tried, but these organs are slightly more complicated. And technically speaking, even whole hand has been transplanted from one person to another. But there are two major challenges. One is, to transplant an organ, we need to have a very sophisticated system that from a dead person, organ is removed in an ethical way when the consent of the patient is available and the family also agrees, all the ethical requirements are fulfilled. Then the organ needs to be harvested. When we see harvested, in a very scientific and sophisticated process, the organ is kept in a way that it is fully functional before it is transplanted to a recipient or a victim who requires the organ. So all the steps are very complicated, it's very costly as well, and lot of ethical issue is also required. That's why we still do not see the kind of transplant that is required. There are a lot many number of people who require transplantation, but they are not getting enough organs.
Okay, sir. So let's tell us a little bit more about the ethical point of view. What are the guidelines for a donor and for a recipient, and what are the complications they can go through after the transplantation?
True, true. So as we understand, it's very unprecedented thing, and organ transplant has been made possible only with modern scientific advantages. Before that, it was not possible to remove organ from one person, preserve the organ, and then transfer to another person. But as and when the new science comes lot of ethical issue. Like earlier in public health, we have lot of discussion regarding blood transfusion also. Blood transfusion also is relatively new process. So a lot of religion don't really allow blood transfusion. Like Jewish religion is there. So we have in public health lot of cases about law and ethics regarding how to do transfusion of blood. Now talking still further, and it is not just blood, like we can donate blood and we can receive blood, and the process is so painless and almost we're having very little complication. But when we talk about something as precious, as unique, like heart, like kidney, like liver, so in that condition, if if I for the ease of viewer, if I compare with blood transfusion, so if someone donates blood, so person is also absolutely healthy.
Yes.
But if someone's heart is taken out, there is no chance of survival of individual. If someone's kidney is taken out, it's very life transforming event. So in that condition, it becomes very sincere, very critical to ensure that nobody falls victim to trafficking. As we can see, lot of cases are there, and WHO has, World Health Organization has created policy of organ transplant, so that, as it has been reported multiple times in news media, many people from poorer community, they are lured for money, and sometimes some illegal force is also applied, where people are forced to donate their kidney. And since it is forced donation, so we can't really say that it is donation. So poor people are exploited for their kidney. Their kidneys are removed, and maybe all the legal hassle follows. So for that, now government has come up with a clear guideline that, like any other process, medical science always suggests that nobody can do anything to body, even the doctors, unless and until the patient has got a very clear understanding. Number one, what are the risks involved? Like, as a doctor, I can't even perform a surgery on a patient unless and until I have first made very clear to the patient what are the risks involved, and understanding the risk, patient gives me a consent. So number one thing is, the person who is donating the organ should give a very clear, unambiguous consent to donation, and that should be based upon very clear counseling. It's not as if I convince him without giving the full information. The second point is, what happens in case of road accident or someone dying a natural death, in that condition when organ is perfectly well. So in that condition, you can place the organ. So placing the organ is like a particular form is there, a registry is there, and someone can place that in case if anything happens to me, and if the organs are in such condition that they can be useful to another person, I allow doctors to transplant my or to harvest my organ and then transplant to other person. So that is possible when first a pledge has been taken and there is a clear consent by patient. So living person should give consent. If a person dies, in that condition after the death, their relatives have got the right to give the consent, or it is still better if we make a right kind of information in the community, and that's why you and me are sitting over here and we are having all the events. So in that condition, if all the living people, when they are still healthy, if they make a pledge that in any case when if my organ can be harvested and transplanted to other people, I allow it. And the third thing is, there should be a strict enforcement of law that there is no transfer of any monetary gain between the donor and receiver, because when comes monetary transfer, it becomes like selling, and we don't really have ethical and legal means to support the vulnerable people. So it will create a situation where vulnerable people are exploited.
Okay. So, sir, please tell us about the compatibility of the organ. Many times we have seen that doctor has just matched the blood group and done the transplant. After some time, the transplanted organ itself damaged after some
True,
medication
true,
or some
true,
lifestyle disorders.
true, true, true.
So, what is the reason behind that actually?
Yeah. So as we understand, to talk about in a very simple language, we all have got a fingerprint which is very unique. So for the understanding of viewer, it is same like our blood and our immune system has a way to recognize what is me, like what are my cells and what are the cells which are coming from outside. Like if you talk about stomach, so stomach can digest organs or meat of another organism, but stomach does not digest itself. Our immune system, if they are attacked by viruses, bacteria or fungus, any other thing, they can attack the outside organism, but our immune system never attacks our own cells. So there is a way, and which is part of immune system, through which our body recognize which are my cells and which are outside cells. So in that condition, now take this concept a little further. So we understand that if anything comes from outside to our body, then our immune system will recognize this as a foreign invasion, like an infection. So the way it treats a virus, the way it treats a bacteria, the way it treats a protozoa or fungus, the same way our immune system will attack the new organ. So it is very difficult situation. Now, in that situation, still considering the genetics and without going into much detail, we can still say there are individuals between which there is certain connectivity. Like if you say between parents and their children, so there is a certain genetic continuity and there is certain genetic similarity as compared to one stranger and as compared to parents. And same way there are different what do you see genetic combination in human body, so which is analyzed by very sophisticated means of examination. So through that sophisticated mean of examination, doctors can find out between which people, like who can be a donor and which who can be a receiver in a way which has got very least resistance. There still will be resistance, there still will be some kind of immune reaction what we talked about, but this reaction can doctors tries to minimize this reaction. To minimize this reaction, doctors apply different sophisticated tests to find out how we can minimize such immune reaction. And beyond that, we also have different drugs available, which are a class of drugs and which is a very sophisticated and continuously evolving line of molecules which are used to suppress the immune system.
So when we suppress the immune system of a recipient, other disease or comorbidity may also harm the patient. It may damage another
True,
organ.
true.
Is it possible?
It is possible. We have got a very nuanced stance over this because there are certain advantages, there are certain
Yes.
disadvantages, and that's
Yeah.
why we say that organ transplant is not a routine surgery.
Okay.
Every recipient, every person whose organ has failed, so one condition is it is almost a last resort when no other thing can be useful. In that condition, only we go for transplant. And then also the patient needs to understand his life will not be same, there will be a huge transformation of life, like as we discussed in the concept, our immune system will react with organs and they will consider the new received organ as a foreign organ. They will make an immune reaction against them. Now we are giving some certain molecules to suppress that reaction, but now our immune system is suppressed. So we are vulnerable to viruses, we are vulnerable to bacteria, we are vulnerable to protozoa. So all the infectious conditions we will be exposed, and all the conditions will become more and more vulnerable. So in that condition, it will be very difficult to fight against the infection. So patient need to take extreme care to avoid the condition of infection. So all these pros and cons are explained. All the do's and don'ts also need to be explained to the patient and their family.
Very well, sir. So it means organ should be identified by the body as its own. If it is taking as a foreign body, it means there is some chance of
True, true,
complications.
true, true.
Fine, sir. So, sir, furthermore, you just explain about the organ trafficking. We are listening so many cases of organ trafficking. Many medical people are also found involved in organ trafficking. So, please elaborate on this.
Ji. As we discussed, it's one situation where the demand is very high. And all the places where demand is very high, whether it is illegal drugs, whether it is precious stone, whether it is arms, all the places where demand is extremely, extremely high and the supply is extremely, extremely low. In all such condition, the society is such that some or other illegal players start coming in. It's the condition in illicit drugs, it's the condition for illicit arms. So same way here is the condition when uh, filthy rich people, middle class people, poorer people, all kind of people are affected with organ failure. So there are certain very rich people whose organ is failed, they have oodles of money, but the organ is not available. So here comes certain illegal player. Since the gains are very high, so despite this being a criminal act, despite almost all the governments being absolutely against it, still they are looking for vulnerable people and they have got their own illegal network of harvesting the organ, since the science also is extremely sophisticated. To harvest an organ, you need to have a very sophisticated and complex setup. So certain people from healthcare system also are involved. In that condition, we need to be very sensitive to this. We need to create more and more awareness about this so that people are not falling prey to this kind of condition. And government needs to be more and more stringent, especially our law enforcement agencies.
Okay, sir. So, organ transplantation is, we think it is very much expensive process. So, as India is a large country, and middle class families are there. So, is it possible for a middle class family to go for a transplantation? Because many people are from one disease and they are getting another disease, because they are arranging money for the organ transplantation, but when they get the organ, the other disease becomes have more severe, and the transplantation again fail.
A very critical question to ask, and there is no clear answer to this condition. At one side, life is involved. On the other side, someone's monetary resources are involved. And in India, we have got a very unique situation where many families went into poverty, and there are certain economic data available in scientific literature which suggests that many family go broke because they had certain cancer like condition or heart condition where the family spent money beyond their capacities. They took loan, and in that condition the patient didn't survive, or maybe its productivity also was not the same, his employability didn't got to the normal level. So in that condition the patient was not able to pay back, the family was not able to pay back, and in that condition family went absolutely broke. So it's really a tough situation for family who are facing this. The process, as we discussed, involves very sophisticated process of harvesting, transplanting. So it's a costly process, it's sophisticated process, it involves really serious money. So families need to do a lot of thinking, and I think counseling should be very detailed in such manner to make people and families sensitive what they can afford, what they cannot afford, and how they can cope with this.
Sir, what is the criteria for a patient? How doctor decides now we should transplant this organ instead of repairing, or instead of giving medicines to the patient?
As we said, since there are multiple different organs for which organ transplantation is considered, but one thing common in all the condition is that there shouldn't be any other alternative. Mostly we consider, since immunity also is supposed to go down with this, so we generally consider all the other means, and when all the other means are exhausted, an organ cannot be revived. In such condition, we still apply different more filters like the age of patient, like the other condition of patients, and based on a detailed scoring system, a team of doctors decide whether the patient should go for transplantation or not. So it will definitely vary from case to case. What's the age of a patient? What are the other condition a patient is suffering beyond the organ which is needing a transplantation?
So, sir, is it compulsory to have a blood relation with the patient to donate any organ, or anyone can, by the consent, can give the organ to the patient?
Technically speaking, as we discussed, doctors since organ, okay, uh, doctors try to minimize the problem of rejection. So the most critical criteria is that there should be genetic compatibility, immune compatibility in such a way that there is very little chances of rejection of the organ. So considering all this, the doctors suggest whether a person can receive organ from donor or not. But having a blood relation is not the only criteria. Definitely, many times it is easier between the blood relation to donate and receive organ, but definitely this is not the only criteria.
Okay. Thank you so much, sir. Thanks for awareing us about the organ transplantation. You have make it little bit. You just, we can say, you are you are awareing the people about the organ transplantation. And thank you for being with us.
Thank you, sir. And through your channel, I would like to say more and more young people should place for organ transplant and make this a very aware decision. Thank you all.